important thing to remember in the theatre dogs again, as soon as we talk about jaw length, genetics is that. So these animals are not really, yes, they can live a good life. You can use them for a jumping pony or riding. It's not a problem with a horse, they can still feed. But this is a genetic fault, and you should not be perpetuating this line of breeding. Just remember, when you have a jaw that is too short, you can obviously see it on the incisors. But also think about the whole table of cheek teeth. That they may also, instead of sitting right on top of each other, now they may sit like this, which is going to make hooks in the maxilla because those teeth don't get worn down. And at the caudal part of the mandible, these teeth are not going to be wearing on something. And so you can get hooks at the bottom as well, appearing over time. In terms of teeth, there are a variety of conditions that we see in horses, starting with supernumerary teeth or extra teeth. Supernumerary tooth is not a retained deciduous. This is where the body has produced an extra tooth. That happen in the incisors, as you can see at the bottom. This horse belongs to a veterinary nurse. And that's quite easy. Usually we can extract those teeth and there's not a lot of consequence. The problem is when they are on the maxilla, that they usually sit palatal to the normal arcade. And you only know about this when there's a sinusitis already. And in this case, you can see it's a post-mortem. We will not be able to get our horse's mouth this big open. Infection has come in between these teeth as food got trapped there. So by the time that you know about it and there's the sinusitis already, you will have to extract all three of those teeth. Because the bone between those teeth has been destroyed. And in a horse, extracting one tooth is a complication. Extracting three teeth at one go in the same place is as close to suicide as you can get. Okay. It's really difficult to try and maintain these horses and keep them out. So we see these ectopic teeth that can occur close to the temporal bone. And these horses, often the client will tell you it's got a draining cyst at the base of the ear, where the temporal bone is on the opposite side. It's not common, but we do see it, and it's a dentigerous cyst that appears in that area, often referred to as an ear fistula. And you have to remove it surgically, but the auricular nerve runs there. It's not something that you really want to do in the field. It's something that, if that is present and it needs to be removed, it's probably better to do it in a more controlled surgical environment. Eruption cysts, all of you will see it one day if you're going to be working with horses, and you must be careful. These are usually horses that are young, and the farmers will tell you, or the owners, that there's these bumps that are on both sides. Okay, so this is where the teeth are busy developing. Maybe you can see it on this radiograph. You can see how thin the ventral cortex at the level of this developing tooth is. So remember, eruption is going to be up till about 5 years of age. So it's in this age category of horse that you're going to feel these bumps. Don't stick needles in. Don't think you're clever and you're going to do a fine aspirate or smear the content of this. It's bilateral symmetrical, and there are many of them. The horse is not painful, it's just something they notice. Because if you stick a needle in there and you take infection in there, that's the end of that. Okay, you don't want to do that. Wolf teeth, I think I've mentioned it before. If you can see them, they're usually quite tiny, sitting right in front of the second premolar tooth. Stay studying thoroughbreds, about 20% of them had it. They can vary in size. You can see the bottom slide. It can be a small little thing, it can be this knuckle that sits there. And the important thing is, usually when they're unerupted, they can be quite painful. In this case, is an old radiograph. You can quite clearly see that is the wolf's tooth sitting there, and it's still covered with soft tissue. So when the bit lies on there, it's pushing the soft tissue against that crown, and it's going to be quite uncomfortable for this horse. So do you need to extract wolf teeth? Especially the dental technicians out there, they love to say if there's a wolf tooth, it must come out. If it's not causing a problem, there's no reason why.
What about just cutting off a bit of soft tissue that's still capping tooth rather than extracting it entirely?
We will cover that in small animals. It's called an operculectomy. So that is, you can. If the question was, if you have the soft tissue covering the unerupted or blind wolf's tooth, can't you just cut the soft tissue away and sort of exposing the tooth, and then you shouldn't have it? It is an option. Of course you can. It's something I know very little about. I'm not a horsey person at all, but I think those that do ride horses, there are a variety of different bits, depending on what you're also wanting to do with the horse and so on. And it's by all means, if that is an option, to just change the bit first and make sure that that doesn't cause the horse the harm, then by all means do it. Yes, my voice is not like in the normal way that a horse chews, the incisors should be like it is, it says normal, not straight line. And any irregularity in chewing will mean that you're going to see it in the incisors as well. If there's pain on one side and then pain on the other side, and they just start chewing on the one side, you're also not going to get that constant wear of all the incisors. You're going to get wear on one side more. And then you're going to start seeing this smile and scar. There's fractures, you can see these tall ones, irregular also where there's fractures, rib biting for instance, that's going to be the kind of bite you see or frown. And so the frown, slant and smile, those all tell you that the side-to-side motion is not as it should be. Okay, so by looking at the incisors, you shouldn't look and say, oh yes, the incisor problem. You look at those incisors and you go, there's a tooth problem at the back. And that's what you need to go and find there. If you were to just take this horse and try and correct that to a normal bite like that, you may not address the problem at all. It is going to be in the back where the problem is.
How long does it take for these problems to manifest and a difference in the incisors? So if there's an issue with...
It'll probably take months. It's not going to be a week or two, but it's also not going to take years. So it'll be in the last 6 months or something to that. Mentioned this already, retained or persistent deciduous teeth. Try and get them out. If they're causing a problem, if you look in a horse's mouth for other reasons, you're just evaluating this horse and there are caps, and the horse is in this age group, you don't have to extract them, because they probably will come out through normal wear and normal feed. It is when the horse's mouth is swelling, when it's painful, when it's not eating properly, and you open, you can see there's swelling around an area. That's where you're going to go and remove them.